The following program is in no way intended to replace your doctor's advice or treatment program, nor should it be used as a tool for the purpose of self-diagnosis.
Good evening. It's Wednesday, the 31st of May, 2017, and we're on another edition of Your Health, Your Choice, Community Health Outreach. This evening, our topic is going to be focused on the 12 causes of fatigue. We have with us Dr. Claude Khan, community diabetologist, once again. And before we go into the 12 causes of fatigue, because we've been looking at brain health on quite a few of our programs in the last few months, we want to move into medicine today, and today actually is World MS Day. We'll be looking a bit at medicinal marijuana, and the final M, I think, is metformin and pre-diabetes. So medicine today, and then when we return after that segment, we'll be looking at the 12 causes of fatigue. Right, so it's World MS Day. I think we have a little logo that we asked Josh to find for us. It's the first, I think, in a series, the 31st of May this year. Precisely, what is MS?
So MS stands for multiple sclerosis. We probably could just come off the logo, multiple sclerosis. So I guess it's like we have World Diabetes Day. We have, I think, a day dedicated for AIDS and HIV. It's just raising the awareness of this particular illness. Interestingly, multiple sclerosis, well, it is a neurological problem. And in fact, on our last program, we had a neurologist with us, so it might have been good to have his comments on this. Yes. It's more common in the Northern Hemisphere and Scandinavian countries for some reason, and we're not sure why, but it's more common in colder countries than in the tropical areas. So even in our medical school training days, we didn't see a lot of multiple sclerosis patients, or we may have seen some and didn't diagnose them because it's not an easy diagnosis to make.
Right. I know we have some friends in the UK who've just been using stem cell.
Well, you know,
therapy.
Stem cell therapy is really kind of a new buzz area of popular area of medicine that's being developed. Very much still in research. I have to say, you know, very quickly that although I've seen some adverts for stem cell therapy here in Trinidad, I would be very, very cautious about those adverts because stem cell therapy is really very advanced medicine. And as far as I'm aware, it's not available. What I understand as stem cell therapy is not available here in Trinidad. And patients need to be aware of that. But it is being investigated, and I think our friends in the UK, I think they're actually in a program where they're looking at stem cell therapy in treating MS, which, if it is successful, would be a great step forward because diagnosing multiple sclerosis is not an easy diagnosis to make. You have to do MRI scans. It's basically what we call demyelination of the nerve fibers. So the myelin sheath, which is the sheath that covers the nerves, becomes worn out, or demyelination is the word that we use. And then people may get a variety of symptoms. Very often blurring of the vision is one of the early symptoms, and then you have weakness of the limbs and muscles, etc. So it's quite a distressing illness, and no good treatments are available. But stem cell therapy is now being looked at.
He had the transplant about a year ago, I think, and he's doing very, very well.
Right.
He's
well, that's good news. That's good news.
So,
but I guess he must be in one of the research
Yes,
units?
I think they waited quite a number of years and started fundraising to go to Mexico to have it done. And then they finally got onto the NHS program.
Right.
So, yeah, he's responded very well to stem cell transplants. So the next topic was going to be the whole idea of medicinal marijuana. Very controversial.
Well, controversial. I mean, it's now approved in a few states in America, and so people are going to those states to be able to access marijuana for medical use. We know that there's no doubt that there are some medical uses for marijuana. Pain control in cancer therapy, very important, and also it's been used to treat some eye problems, glaucoma, etc. What concerned me, I saw something on Facebook yesterday, saying that medical marijuana can be used for the treatment of cancers, and instead of chemotherapy, and kind of putting down chemotherapy. Now, we say, and I've heard this talk very often, that chemotherapy, chemotherapy is often like poison.
Like a toxin going into your system, yes.
And I think, very often people say things, and things are placed on Facebook without any scientific evidence to back it up. And we often talk about this, that and I often respond to these Facebook posts, because I think it's very important that patients understand that there are some cancers that will respond to chemotherapy very well. There's no doubt that chemotherapy is a very powerful tool, but if it's used in the right way and it's in the proper supervision, it is very effective in some kinds of cancer. So when somebody puts on Facebook, do away with these toxins, chemotherapy, and use medical marijuana, it is such a simplistic way of looking at treating cancers. And I think it's unfortunate, and whoever is promoting that, I think you're doing a disservice
to the public. But would you completely dismiss the use of marijuana?
No, not at all. I think there is a place for medical marijuana, but I have to say very quickly, of course, in the States now it's been approved not just for medical use, but for recreational use. And I think in Jamaica you're allowed 1 or 2 joints.
An ounce, I think.
You're right. Yeah. But we have to remember that when we did this research, that there are negative effects to marijuana that people don't tell you about, especially early use. When I say early use, teenagers using marijuana, like alcohol, like other drugs, the brain is still forming, and young patients often present with psychotic episodes because they've been exposed to marijuana use. So, if you're in your 50s and 60s, you may not have many side effects, but of course marijuana use can also slow down your reflexes, your mental capacity to think and reason. It might relax you, but if you're taking marijuana and driving,
because it is acting on the central nervous system.
Absolutely. So I think, yes, medical marijuana is something that we can look at in the years ahead here in Trinidad, but it has to be closely monitored.
Okay. All right, and then we wanted to look at the third M. So we've done MS, we've looked at medicinal marijuana, and the third M in medicine today is metformin and pre-diabetics.
So there was some new, this is new and old data. Because we have known for almost 20 years that from the diabetic prevention study and the diabetes prevention program, that exercise and metformin can delay or even prevent the onset of diabetes. I think what this latest research was showing is that not just metformin, but a very aggressive approach to pre-diabetes. Now, interestingly, I saw maybe 2 or 3 patients today with pre-diabetes, and I am of the opinion that people with pre-diabetes can be placed on medical treatment to try and delay the onset of diabetes, because the longer you wait to treat pre-diabetes, you are putting more stress on the beta cells. So, metformin gets a lot of bad press. And again, I want to say to all our friendly herbalists out there who often say that metformin damages your kidneys and damages your liver. That is absolute nonsense. Can I repeat that? Absolute nonsense. You simply do not know what you're talking about. And Linda, I know you think I come across very strong.
Yeah, I think you're coming across
no,
very strong.
but listen to what I'm saying. We are doing our patients a disservice. Metformin, Linda, actually protects your eyes. It actually protects your heart, and it protects your kidneys. And we have people out there who have not one day of medical training telling people that metformin damages your kidneys. Now, why do I get agitated? I should get agitated because I am seeing the effects of people coming off their metformin, going on to diabetes, and then going on to the complications of diabetes. Am I agitated? Not just agitated. I'm sometimes angry, justly so. There's something called just anger.
Righteous indignation.
Righteous anger. And this is one area where I'm righteously angry because I see the outcomes of poor information. So metformin, Linda,
yes,
is good for prediabetes.
Good for prediabetes, and the research proves all of this.
Yes. I'll cool down now.
So we've come to the end of this medicine today's segment. When we return, we'll be looking at the 12 causes of fatigue and looking at ways of fighting this fatigue that seems to be leading to burnout.
Yes.
Yeah, very prevalent in our society today.
I found out that if our phones are close enough and if we have a connection on Wi-Fi and Bluetooth, come on, I'm about to preach this technology until somebody comes out of hiding. If I got something on my device and you need it on your device, if I can get close enough to your device with my device, what's on my device can jump on your device. If I get close to the one who created me, close to the one who called me, if I stop running and return to the place of my assignment, I got the drop.
God can use you no matter who you are, if you'll be sure that your life is clean and obedient before God, no matter what you face, what situation, what the problem may be, God and you together can be victorious no matter what.
So that was a pretty easy one, oncology. So we're moving in now to the segment, the main segment of the program. We wanted to look at the 12 causes of fatigue. Now, I know whenever we say we're going to enumerate a number, we sometimes never get to, to the final number, but we will try this evening to get to number 12.
Well, actually, I would say that this might take us two programs to do, because I really want to. The reason for that is that there's an acronym or something that we use called TATT in our notes, tired all the time. And that's one of the most common symptoms we see in family medicine and in diabetes, patients complaining of tiredness. And I often joke with patients when people come in and tell me they're tired all the time. I get tired. Why? Because I know it's going to be a difficult diagnosis to make. And the problem we're facing is that patients often want a quick fix. So we're going to show tonight how complex tiredness can be, and just taking a multivitamin supplement or taking Omega XL or Sure Cure or one of these multivitamin pills may not do the trick. You really have to dig deep in making the diagnosis of why people are
Tired all
exhausted.
the time.
Yeah.
Fatigued. Okay, so number one then.
So let's just bring up this first slide, and this is maybe very obvious: not enough sleep. So don't overlook the obvious. One of the most common causes of fatigue is getting too little sleep. So,
Right.
Linda, let's talk about sleep.
Yes.
There's a statistic here that says in India, almost 120 million Indians do not have a chronically sleep deprived.
Yeah.
So we know that sleep is absolutely important for regeneration, for restoration of our bodies. And the problem we are having is that people are living such busy lives, such stressed lives, that they're not getting enough sleep. So, Linda, if I were to ask you, what would you think would be a good number of hours per night?
We were always told, get 8 hours sleep.
Right.
And yeah, so
But
for some adults, they just need 5.
Well, we say that, and some people can function very well with just 4 to 5 hours of sleep. But we do know that a lot of research has gone into this area. And if you're not sleeping well at night, or if your sleep is very broken, now, there's some of us who have thrived on that way of living, but it's not the most healthy way, especially, the people who have been on call for many years, people who do a shift pattern of work. There are lots of things that can affect your sleep, what we call sleep hygiene.
And there are different kinds of sleep, the REMs and
Right.
yeah.
So there's the deep sleep and there's the more superficial sleep. But let's just talk a little bit about, what can help you have a better night's rest, sleep. Well, of course, if you're very stressed and anxious and you get home in an evening and you try to get to bed right away, it's going to be very difficult to fall asleep. And what some people find is as they get older, and this is very, very common, as people get older, sleep becomes more difficult.
Yeah.
We're not sure why. One of my theories is that people are not as active as they would have been. And a lot of people don't realize that they're falling off to sleep intermittently during the day. So they might be having a 15-minute nap or a 20-minute nap.
Cat naps to rejuvenate.
Right.
Yeah.
So to sleep at nights, you have to be tired.
Yes.
So if you're not tired, if you're not exhausted, it's going to be very difficult to sleep.
But then your brain could be so overworked that it doesn't shut down
At
when you
night.
need it to. Yeah.
So we need to develop good sleep hygiene. So a period of relaxation and unwinding, however you do that on an evening, and getting prepared to sleep. Now, if you're on Facebook, or if you're watching Netflix,
Yeah.
for example.
You're not pointing fingers here
No,
by
no,
any
no,
chance.
no, I'm not. Part of the problem, obviously, is a lot of our teenagers
Yeah.
are going to bed with their phones
Yeah.
and their iPads, and
That light
that light,
is...
that light from those screens have actually been shown. I have to say, I have found there was a time when I was looking at Netflix for a period of time, that program called Suits.
Yeah.
Very nice program. But I found that was much more difficult for me to fall asleep after watching 2 or 3 of those programs. And I realized after the light
Yes.
from the screen as opposed to the television screen is very different, and it seems to stimulate the brain. So if our kids are going to bed, and this is now well documented, parents have been encouraged, especially with their teenagers, to take away their phones at night, take away their iPads, and restrict it because they're not sleeping well at night.
No, and they're often chatting quite late in the night and falling asleep in class the next day.
The next day.
Yeah.
So sleep hygiene, relaxing, but even your bedroom itself, the colors can have a calming effect. If your bedroom is
Bright orange.
bright orange or red, that's a very excitable color.
Yes.
Even some churches are having sports days and they're having red colors, and that's meant to be power
Stimulating.
color. but I understand that that color did not win that sports day. I'm talking about Faith Assembly. If anybody from Faith Assembly is looking at us tonight, I was following you guys on Facebook. But your room, if it's too hot, if it's too cold, if it's too bright, I find it extremely difficult sleeping in a very bright room. I have to have dark color, the shades drawn down.
Yeah.
I think you find it very easy dropping asleep, whether it's bright sunshine or not.
And once I'm tired, that's it.
Yeah. So sleep, and this may, and the reason we have brought this up first is that somebody may come in and they say that they're tired all the time, and we never ask the question
about their sleep patterns. Yeah.
Simple question.
And then Shakespeare put it very, very nicely when he says, sleep is that balm for sore minds, and it knits up the unraveled sleeve of care of the day's, all the day's activities and so on. And of course, there have been so many studies. One I was reading from the University of Surrey, and the whole thesis behind it was that sleep is actually cleansing the brain of toxins.
Right.
So it's a necessary part of a healthy lifestyle.
Yes. So the first thing about fatigue, are you sleeping well? Are you getting at least, I would say, about 6 hours? Now, of course, we know, Linda, that people, particularly in the South land, working in Port of Spain, they often leave home at 4 or 5 in the morning, getting back home at 7, 8 at night. And some people are then studying. A lot of people are doing postgraduate. So people are very stretched. And if you're only getting 4 to 5 hours, not only is it dangerous driving, but you are going to be exhausted.
Yeah, it's affecting your brain cells. Also want to make an appeal to those nightclubs and so on that play their music very, very loudly on Sunday nights or nights before other people have work the next day. And you hear this constant thumping of bass and DJ voices and so on that inhibits our patterns of sleep.
Yes.
So if our environment is not inducing proper sleep habits, then society generally is being affected in terms of productivity and the long-term effects.
So here's a simple, and that's why we're not going to cover these 12 because this first one.
This is the first one.
But here's a simple example. If a patient comes in and says they're tired all the time, I could rush in to do their blood sugar, their blood count, their thyroid function, etc., etc. And we have not talked about the simple first thing: how are you sleeping at night? So I would encourage my colleagues and to the many who are watching tonight, are you sleeping well at night? If not, you need to look up and start reading about sleep hygiene.
Okay, good. So that's the first cause of fatigue. Second cause?
Okay, so the second
Number
one
two.
is we're going to bring up this slide again. The second slide, it's sleep apnea. So this is an increasingly popular area of medicine. Some people think they are sleeping enough, but this is a very, as we say, a sneaky condition that gets in the way. And sleep apnea basically stops you breathing intermittently during the night, and the result is that you're sleep deprived. So it's called obstructive sleep apnea or sleep apnea. Basically, the airways get closed off. It's often associated with snoring. And, we used to joke about people snoring and think it's just a nuisance and blaming the person who is sleeping from causing the other person to be sleeping.
Yeah, the snorer who is suffering from sleep apnea is actually interrupting the sleeping pattern of the
other person
partner in the room. Yes.
But very importantly, sleep apnea is a medical condition. There are several ENT specialists now who can do special tests. There's also a company called Island Sleep Diagnostics.
I think you had them. We had them on the program.
Right.
Before.
Yes, in the early stages where you there's a little device you sleep with for 2 nights, and it can actually diagnose whether you are suffering with sleep apnea. So the important thing about sleep apnea is that it can result in you not having a proper night's rest. And I remember well at the 2006 World Cup where we met someone from Barbados who actually showed us this little machine, a CPAP machine, which was the first time I was seeing it, that he traveled all over the world with. And he related to us that he would fall asleep in meetings, and so sleep apnea can result in tiredness. And recently, I have seen quite a few patients who are diabetics but also have sleep apnea. And the thing about sleep apnea is not just the tiredness, but it's linked to heart disease, hypertension, and metabolic syndrome. So treating sleep apnea is not just giving you a better night's rest. It's also probably going to treat your hypertension and other medical conditions.
So how do we treat sleep apnea? Is it surgical, or is it
well, it used to be
intervention?
It used to be surgical, but now we are recognizing that some of the surgical interventions are not that effective. And the most popular way of treating sleep apnea is actually a CPAP machine, a continuous. CPAP means continuous positive airway pressure. It's a little machine now. It sounds a little bit cumbersome, but it's a little machine that there's a mask you put over your face, and it's a pressure airway, air that is being forced down your airways, and it keeps the airways open. It may take you a little while to get used to it.
Yeah, and you have to sleep on your back if you're using that.
Yes. What some people have realized is that if they change their sleep position, that may help with the sleep apnea. So surgical intervention. I've seen recently on cable where they're now promoting certain devices that you put in your mouth and it keeps the airways open. To be honest, I'm not sure how effective those devices are, but it is being promoted very, very aggressively.
Great. So that's two. Let's consider the third cause of fatigue, which is not enough fuel. What do we mean by that? Not enough fuel.
Eating too little is another obvious cause of fatigue, but eating the wrong foods can be a problem.
So what are the right foods and what are the wrong foods?
Right. I just want to remind people that after our second break, they can ring in and ask questions. I know when we do programs like this, we don't get as many calls as when we do diabetes, but there are lots of people who are tired out there, so you better, you can ring in and ask your questions. So what are good foods and bad foods? So the slide here says having a good breakfast is very important. And I know we are laughing here, but because I don't.
Yeah, you're not a breakfast person.
I'm not a breakfast person. Now, that's extremely difficult. Of course, when we go on holidays, I do have breakfast, but I'm much more relaxed. And I find when I have a big breakfast, I feel very lethargic. So maybe it's a kind of breakfast that I'm having, because if you have, a lot of oily foods, eggs and fried eggs,
you can have what I have, which is oatmeal and nuts and grains and
whole grain and toast,
cranberries,
cranberry. Yes. I have to congratulate you, Linda. You're a very healthy eater, but I have to say, in my defense, we are a product of how we have been brought up. And while my parents brought me up very well, I think, in terms of our eating pattern, it was probably not the most healthy foods that we did. Well, in those days, we were not aware that cereals were so good for you. But you grew up eating cereals and...
It was something, it was just what our family did.
Right.
So,
and it's much easier for you to continue that pattern, and of course you have taught our kids to do the same. I still find it hard to eat cereals, etc. But let me get off my personal challenges.
But the idea is that we want to include proteins, which take a longer time to digest,
right,
and whole grains.
And whole grains.
In your breakfast.
Right. So if you're not eating healthily, so what some people do is they take these high-calorie snacks that might give you a burst of energy, but then it's digested very quickly, whereas proteins and high-fiber foods are digested more slowly, and therefore your energy levels can stay much higher over a longer period of time.
So you don't feel as tired.
Absolutely.
Okay. So that's the third one.
Yeah.
And we'll move on to anemia.
Well, this is a big one. This is we need to spend some time on this one. Anemia is a leading cause of fatigue, particularly in women, it occurs when the body doesn't have enough red blood cells and enough oxygen to carry around the tissues. So we can just come off that slide. I'm not sure if we have to go to a break soon. So anemia. So basically, if you have...
Is that an American spelling? Oh, yeah, it looks like an American spelling of anemia. Yes. Okay.
Yeah, and
apologies.
Yes, I know you're not big on the American way of life right now, especially people in the White House. Anyway, let's move on very quickly.
Yeah, let's not talk kerfuffle.
Yeah, we might get some tweets late tonight. So anemia. So it's basically a low blood count.
Yeah.
And again, you know, a patient may come in and say they're tired all the time, and it should be a basic thing to do a full blood count. And when you do a blood count, you're looking at the basic things is the white blood cells, the hemoglobin, and the platelets. And often patients get a little bit confused because under the white blood cells, you have the neutrophils, you have the eosinophils, the different types of white blood cells. And some people see it's low or high and they get confused. I tell them, look, just look at your total white cell count. But when we talk about anemia, we're talking about the hemoglobin. And iron deficiency anemia is one of the most common causes of anemia. And that's obviously when your iron levels are low.
Yeah.
And therefore, if your iron levels are low, there's not enough oxygenation. The red blood cells is what carries oxygen around to the tissues.
And gives you the energy you need
to live, to exercise, etc. But it is very important to diagnose the cause of anemia. Saying someone has an iron deficiency anemia is a diagnosis, but it is not enough. You need to go one step further to find out the cause.
Usually it's diet, isn't it?
Well, now this is interesting. So I want to go into a little bit of detail about this.
Yeah.
This is where the art of medicine comes in. This is where people who are not trained to do medicine should not be doing medicine. Because if someone comes in to you and says they're tired all the time, and you just take something off your shelf and say, this can cure your tiredness, you can very well be missing a cancer. If a patient is over 50 and presents to you with an iron deficiency anemia, it is different to someone who's 21 presenting with an iron deficiency anemia. And you know, people may say, oh, there's Dr. Khan going on again about the art of medicine. The art of medicine is treating each patient as an individual and not saying that one product can heal you of everything under the sun or one diet. Because if you have an iron deficiency anemia and someone gives you a diet that's for everyone, that's high in fat, for example, that may not be appropriate for you. So the point I'm making here, though, is that most women who have an iron deficiency anemia, it may be due to heavy periods, especially women between the ages of 20, 15, adolescents up to the menopause. So a young girl presenting to me with iron deficiency anemia, I would ask about her cycles, heavy periods, etc. I probably wouldn't be very worried unless, the blood count is 6 or 7. Diet, as you're saying, very important. In the old days, we used to have things like hookworm, which was a common cause of iron deficiency anemia. But we have to go to a break?
Yes, we do.
Okay. So I'll come back because this is very important.
This is an important point. So we'll return in a few minutes. Don't forget, when we move into the next segment, you can call in with your questions. The number is 652-4855, and Dr. Khan will be happy to answer any questions you have. We return in a few minutes with Your Health, Your Choice. We're looking at the 12 causes of fatigue. Well, that was an interesting bit of medical trivia there. That was the last one I would have thought of, hiccups. Before we go into the, well, we're discussing anemia as one of the causes of fatigue. We just want to show you a little clip that we prepared earlier on fatigue.
Fatigue, it is something we have all experienced at some point. Maybe you felt tired, had difficulty staying focused, lacked motivation, or maybe your eyes felt like lead and you found it hard to stay awake. But what is fatigue actually? There are many definitions, but if we really want to understand fatigue, we must differentiate between two existing types: physical fatigue and mental fatigue. With physical fatigue, your muscles feel worn down and hard to operate, while mental fatigue affects your cognitive functions. There are two types of fatigue. The two types of fatigue have different causes and must be treated accordingly. Let's take physical fatigue. The main trigger that causes it is physical exertion. Imagine running a marathon and pushing your body to its limits. Naturally, it reacts and gives you a signal to stop and recharge. Physical fatigue can also be made worse by illness, lack of appropriate nutrition, and dehydration. However, physical exertion is the main cause. To cure fatigue caused by physical exertion, you need to rest, just like an athlete. In order to keep performing at an optimal level in sports like basketball, players take frequent turns on the bench to recover before returning to the court again. So, to counter the effects of physical fatigue, ensure you take rest breaks at regular intervals. Mental fatigue, however, is triggered mainly by lack of sleep. Illness and stress may also contribute, but lack of sleep is the main cause. To cure mental fatigue, resting is not enough. What you need is a sufficient amount of good quality sleep to replenish yourself. In regards to your safety and well-being, mental fatigue typically represents a larger risk than physical fatigue. If you become physically fatigued but continue to exert yourself, you stand the risk of picking up a soft tissue injury, such as a sprain or strain. But if you become mentally fatigued, things become more dangerous, as critical activities such as driving whilst drowsy can lead to disastrous consequences. Regular mental fatigue can also decrease your well-being by reducing your energy and motivation to engage in health-promoting activities such as exercise and spending time with family and friends. To effectively manage fatigue in any organisation, therefore, it is important to prioritise addressing mental fatigue caused by lack of sleep. From a company perspective, this starts with appropriate roster design and ensuring employees have adequate breaks and free time to get the sleep they need. It may also entail providing employees with training on how to optimise the quantity and quality of sleep they obtain. From a personal perspective, it is important to use your breaks and free time appropriately by getting enough sleep and addressing sleeping problems quickly when they occur. In the event you find yourself too tired to work safely, you should immediately communicate this to your supervisor or other appropriate person. In all cases, your safety and well-being is what matters most, and this starts with making sleep a priority.
Okay, so that adequately summarised the first point we were making
Yes.
about sleep and as being the main cause of fatigue. So, or lack of sleep, sorry. So you can call in, don't forget, the number is 652-4855. That's if you're viewing the programme tonight live, Wednesday the 31st of May. We do have the programme on again Thursdays at 1 p.m. and on Sundays at 7 p.m. Those will be reruns and you won't be able to call in then. So take advantage of the opportunity now. So let's continue with this point on anemia.
So the clip mainly talked about sleep and physical exertion. So we're going a little bit more in depth. So I was saying that a young female presenting to me with an iron deficiency anemia, I would look at the menstrual cycle, and diet, for example. But if someone comes in 55 years old with a hemoglobin of 8 and a definite iron deficiency pattern, that there are red flags, what we call red flags. So that patient should be referred, preferably first of all to a gastroenterologist, to have an endoscopy and a colonoscopy. That's the first port of call to make sure that there are no tumors, no malabsorption problems, and then maybe further investigation. So anemia is often a hidden, and sometimes people may have a normal blood count, a relatively normal blood count, but this might be iron deficient.
Yeah. We do have a caller on the line. Good evening.
Yes, good evening, doctor.
Good evening.
Does glucophage has the same protective quality like metformin?
Glucophage?
Glucophage?
Yes.
All right, yes. So metformin is the basic chemical name, but that drug comes in various brands. So you have the normal metformin, you have metformin DENK, and you have glucophage. Glucophage is considered probably a slightly a better brand than the CDAP metformin, and even our Minister of Health said recently that some of the CDAP drugs are a little bit inferior. So glucophage and metformin are basically the same drugs, but they are different brands of metformin or glucophage.
I just wanted to ask one question about the, thank you for calling in with that question, by the way. But with anemia, you mentioned a hemoglobin level of 8. What is a good hemoglobin?
A good hemoglobin level is I would say for a female above 12 to 13, for a man about 14 to 15.
And bad would be what's the cutoff point?
Well, I mean, if you're falling below 10, that's to be concerned about, and if it goes down to 7 or 6, that's very bad. Okay. That's a reason to be hospitalized and for a blood transfusion. So if someone has now let me just quickly add that people with chronic kidney disease and certain chronic medical conditions like rheumatoid arthritis can have an anemia, but that's called anemia of chronic illnesses, and it's not necessarily an iron deficiency. So that's why you have to be careful about giving everyone iron with a low blood count. You need to find out the cause.
Okay, so before we move on to our next point, we have a caller on the line, so we'll take that call. Yes, good evening.
Good evening.
Can we have your question, please?
Hello, good night, Doc.
Yes, good evening.
Well, sleep. I can't sleep like 2 o'clock, 3 o'clock when I go to sleep. I don't know why. I eat in and everything good and normal.
How old are you?
I'll be 70 this year.
Okay.
I'll be 70 this year.
70, okay, thank you. Thank you.
All right. Okay.
So this is a typical problem we talked about. As people get older, they have a disruptive sleep pattern. What do we do? Well, let's go back and, you should see a family doctor, take a proper history. Funnily enough, if you're active during the day, you might sleep better at nights. So one question I would ask you is your activity levels. You say you're eating fairly healthily, but we know that some people become chronic insomniacs. No known cause. And I know this is controversial, but I think there are some patients where drug therapy, medication, is an appropriate therapeutic option. Now, I know a lot of people are concerned about the addictive potential of sleeping tablets, etc. But what I would say is that there's more harm in not sleeping well than taking something to help you sleep. Of course, there are some natural products like melatonin and herbal teas, etc. But there are some people who need prescription drugs.
Perhaps he could try a little more exercise as well to get the body going during the day. We have another caller on the line.
Sure.
So, yes, good evening.
Hi, good evening.
Good evening.
Dr. Khan, I'm Susan.
Yes, hello.
I have a lot of sleepless nights, as what you're speaking about. and loss of energy. But you know I'm a little extra size. I am Susan, your patient from Siparia.
Okay, okay. Right.
Yes.
So you're not sleeping well.
I'm eating, but I'm not sleeping.
Right. Okay. And
I have a very loss of energy, no matter how much I try.
okay. But you're diabetic.
Yes.
And your diabetes is not well controlled.
And you know the foot not so well. You told me there was lymphedema.
Okay.
And with circulation.
Right.
Yes.
Okay. So I'll try and answer. It's not an easy problem to deal with. This patient, without releasing confidential issues, does have a lot going on and several medical problems. Interestingly, the other, we were talking about anemia, but the other point we were going to make about fatigue is depression. Now, I'm not saying you're depressed, but depression can cause your sleep pattern to be interrupted. So in your case, I think, I'm not sure if I remembered you said you were exercising, but if you're not exercising enough, right, so you have a problem with the feet. A lot of diabetics have diabetic neuropathy. Some people have amputations. Some people have severe swelling, lymphedema, very, very legs that are very swollen. That makes it very, so it's easy for us as doctors and healthcare professionals to say, go out and exercise, do this, do that. But there are some patients that are really struggling with a variety of medical problems. And that's where the holistic approach to medicine is sometimes what we are lacking here in Trinidad. Someone like this may need some physiotherapy, may need some occupational therapy, may need some counseling, etc.
Okay. We have another caller.
Yes.
So we'll take another call. Yes. Good evening.
Good night, doctor. Two quick questions.
Yes?
If someone is not sleeping properly because of a lack of iron in their body, how do you identify that, the patient? And second question is, like, I sleep for an hour, half an hour, and wake up and feel like I sleep for 4 and 5 hours. Is when I look at the time, I realize I don't have enough sleep. I just an hour. I can't understand that. Help me there, please. Thank you.
Okay, so I think the first question was
about iron.
No, we're not saying that iron deficiency causes a sleep disturbance. I think let's just clarify what we're saying. We're giving the causes of fatigue. One of the causes of fatigue is poor sleep. Another cause is sleep apnea. A third cause of tiredness, of fatigue, is
lack of iron.
Lack of iron. So we're not saying that the lack of iron causes a poor sleep.
Right.
But if you're tired all the time, you need to do a blood count to see if it's iron deficiency. The second thing he said, very interestingly, he sleeps for an hour and he feels like he slept for 4 hours. Well, we know that there are some people who can do what we call power naps. They take a half an hour during the day and they are revived for the next 8 or 9 hours.
Yes.
So it is still an interrupted sleep pattern. And I think, again, you need to go back to the sleep hygiene and retrain yourself literally to get longer periods. I think at least if you can get 3 to 4 hours of sleep at night. If it's during the day, half an hour is okay. But at night, at least about 4 hours.
Yeah, the Spanish have their siestas.
Siesta, yes.
Okay, we do have another caller on the line. Good evening. Can we have your question, please? Hello?
Hello.
Yes, good evening.
Can we have your question?
Yes, good night anyhow. I watch you all the time.
Thank you.
But what happened, I have my foot, I have a leg here, the right leg. I have my left leg.
Yeah. Yes, go ahead.
Yes, it pained me a lot. And I could do what? I could rub it, I could walk, I could take pain tablets, I could take injection, and nothing doing, and it's kind of pulling inside. I can't sleep. When I lie down, it's pulling inside. I have to get up and walk. And it's days
Okay.
5 days, 6 days,
Diabetic.
and nothing I'm doing at all, at all.
Are you diabetic?
Yes.
Yes, okay. So without knowing the full cause, the full history, it could be diabetic nerve end damage. So there are drugs. We didn't ask if you're taking any medication, but there are things like Lyrica, Cymbalta. There are a few natural supplements like alpha lipoic acid, etc. But it could be what we call a pinched nerve, especially if it's one leg that's been affected. So my question would be, have you had any investigations done? You may need to have an MRI scan of the back to see if there's any compressed nerves or slip disc. I know these things are expensive, and right now in the government service, a lot of these investigations are not available. So you can be treated, but you need to get a diagnosis.
Yeah, that pulling sensation in the
Yes.
foot is, I'm wondering if it's connected to like a sciatica.
Sciatica, yes.
Yeah.
So I just want to remind you that we may not have time to take all the questions, but during the week you can ring on 482-4269, 482-4269, or you can have a look at our website, www.anaposiscommunity.com. There are all our contact details there, and there's a lot of medical information on that site as well.
Okay, so let's. Oh, yeah, we have one more call. We'll take one more call. This is the last one this evening. Good evening.
Take a few more.
Hello.
Yes,
Dr.
hello.
Khan,
Yes,
Madam
hello.
Khan, a pleasant good evening.
Good evening.
I just want to thank both of you for a wise program this evening. I appreciate it very much. This program would help me very much. Thanks once more.
Oh,
No question?
Thank you very much. So we can take one or two more calls
Okay.
if necessary,
Okay.
because we want to take as many calls as possible. But the next reason
Cause
for
of
fatigue
Yeah.
fatigue is, we can bring this
Depression.
up, depression. Right. So you may think of depression as an emotional disorder, but it causes many physical symptoms as well. Fatigue, headaches, loss of appetite. So depression is, again, we often think of depression as mainly in the field of psychiatry, but depression is incredibly common. Now, we use the word reactive depression or clinical depression, and just today I was seeing a patient and I asked him if he was depressed, and he kind of laughed.
Taboo, yeah. It's
Yes,
a taboo word,
and
yeah.
he said, "Oh, do you mean I need to see a psychiatrist?" I said, "Well, maybe, but it's not a taboo area to say you need to see a psychiatrist or psychologist." So interesting. I think we have
Or
another call.
psychotherapist.
Yes.
Yes, can we have your question, please? Good evening.
Hello?
Yes, good evening.
Yes. Good evening.
Hello, is the doctor hearing me?
Yes. Yes.
This is Dr. Khan?
Yes.
Okay, Dr. Khan, I'm an ardent admirer of your show, right? I know my problem isn't related to what you're talking about, diabetes, but I am 67 years of age, and I am in the district clinic. But what happened to me, I am hypertensive, right?
Yeah.
I suffer with high blood pressure due to a slip disc. And what the clinic has me on Acatan, and mine is another pressure tablet. And they have me taking this every day. So I asked them, is my privilege, do I have to take it? They say, yes, I have to take this every day to control the pressure because of the pain. But I was wondering if I should go for a blood test, or what should I do? Because I test my blood pressure, sometimes it is down, it is normal, and they still have me taking this tablet every day.
Okay.
So I would like a little advice, because I admire your show, and I would like you to give me an advice if I should go and
Sure.
take some tests privately, or
Sure.
what should I do?
Okay, so hypertension, that's a completely separate program. But let me just say quickly, hypertension is a chronic illness. And you have primary hypertension, secondary hypertension. And with primary hypertension, there's no known cause. And so you may do a lot of investigations and you come up with no diagnosis at all. Yes, your blood pressure may appear to be normal at times, but the question is it going up at different times of the day? So one of the things to do is, if you go privately, is a 24-hour blood pressure machine ambulatory. You have it put onto you, and it measures your blood pressure every hour of the day, and that will show you whether your blood pressure is spiking at different times. The other thing quickly I would say is to do an echocardiogram, because if you see an enlarged heart, it means that that is a marker for hypertension, and you need to stay on your blood pressure tablets. So yes, you can go privately and see a cardiologist and have those tests done. But you can ring us on 482-4269. I think we only have about 2 or 3 more minutes.
Yes, you do need to do that last bit.
Pastoral hat. So, Linda, we may have to do a second program.
I think we're halfway there. So, yes, we can do another program on fatigue, the causes of fatigue.
And I want to thank people for ringing in tonight. I mean, we've had a lot of calls, and it's been really great. So as I put my pastoral hat on, we only have 1 more minute. We have just started a 4-week preaching series at our church, the Trinidad and Tobago Anapusa Center, called Overcomers. And one of the things we talked about on Sunday was overcoming the curse of comparing yourself with others. I want to leave you with this thought. Where comparison begins, contentment ends. Think about that. Where comparison begins, contentment ends. You may have a perfectly good life, but when you begin comparing yourself, as a pastor, if I think about other churches that are larger congregations, I begin to be dissatisfied. I think my church should be bigger. Or, Linda, I think my house, I should have a bigger house, or bigger car. My car is a nicer kitchen. The house or the car it's perfectly good, but we begin comparing ourselves to others. We are almost out of time. Can I say, find your purpose in God. Find God's will for your life. Find his assignment for you and run in that lane of assignment. That's my pastoral talk for you tonight. You can look at our website. You can ring us on 482-4269 for further information. Linda, over to you.
Well, thank you very much. Thanks for joining us on another edition of Your Health, Your Choice. We hope that we have answered a few of your questions, and we'll return in a fortnight's time with more on the causes of fatigue. In the meantime, live well, love often, and laugh a lot.
The preceding program is in no way intended to replace your doctor's advice or treatment program, nor should it be used as a tool for the purpose of self-diagnosis.